Where are we, Gino?
We're on the 5th floor of the PHTA, the Precision Health Tech Accelerator, one of our big labs designed to grow companies in life sciences and healthcare. So I'm delighted to see Al, our local MP, here today.
Thanks. I think this is a fantastic opportunity. I mean, Birmingham has one of the biggest populations in the UK. It's the most diverse population, and it's got this wonderful life science centre where you've got medical universities, you've got various hospitals, you've got the head of Defence Medical Sciences, so it's a perfect nucleus to help life sciences connect up with Cambridge and Oxford and really drive forward.
So just, Gino, within this building, great big building, and we'll get some shots from the outside to really show that how big it is, there is space here for a much needed clean room. So tell us about that.
Yeah, so also on the 5th floor, we've allocated 5,000 square feet to create a clean room. What a clean room is, these are sterile areas where you can make injectable drugs, and most drugs are injectable, like a vaccine. And would you believe, despite our size as a region, we don't have many large facilities dedicated to make drugs that need to be injected under sterile conditions. So we're on a mission to install this critical infrastructure in 5th floor of the PHTA, and that will be transformational across the whole region, and in fact, across the United Kingdom. It will help drive our initiative to increase clinical trials in the UK. More clinical trials, more innovative medicines, better outcomes for patients.
So Al, obviously as a government minister you couldn't possibly comment on that and the funding for it, but I know you're a big fan of life sciences and how important it all is, so perhaps you can say something that won't get you in trouble about that.
Well, this is all about really making the nation as healthy as possible. And here, as I said before, we've got one of the biggest populations, the most diverse populations and the youngest populations. And when you combine this with Cambridge and Oxford and a huge population, the same size as Norway, well actually bigger than Norway here in the West Midlands, it provides a perfect opportunity to do test trials and use medical innovation to drive better health standards across the UK.
So here we are again, different room, same place. Al, talk about the economy, SMEs.
Well, I mean, we've got 5 million SMEs across the country. And this provides perfect space for those medical startups to come in, set up, test, trial, develop and expand. So it's a fantastic opportunity to take small and medium enterprises and grow them into large, which will just drive the economy even further.
And so that, Gino, is pretty much what this is about. It's about health outcomes and improving them, but also it's about driving economic growth, right?
Absolutely, and I think there was some data that the CBI presented in 2010, if we looked at America, that actually over a 20-30 year period, most of the jobs are coming from new companies. So it wasn't the likes of Ford or Pfizer or Merck creating jobs. It was new companies like Google, Facebook, all those kind of new companies coming forward. So SMEs are a driver for growth. So this is about, and what a great industry. You make people live longer, healthier, create fantastic jobs for high skilled people, and at the same time grow the economy. And that's what we're driven to do, basically.
There's interesting. There's two things. There's SMEs, small and medium enterprises. And then there's subject matter experts. There's two meanings of that acronym. And here in Birmingham, you've got subject matter experts all over the place, and you've got small and medium enterprises. Now you've got the space to grow. What a great combination.
Here we are in the third room of the building. Now we've got a view of the magnificent QE hospital here in Birmingham. Al, talk to Gino about why he came here.
Well, I'll be really interested to hear Gino's view, but we've got a fantastic nexus of sort of medical expertise right here. Gino, what's your view with the great background we've got in
So I worked for 20 odd years in the pharmaceutical industry, and I didn't realise that one of the biggest hospitals in the United Kingdom was the QE. One of the biggest medical schools in the United Kingdom was Birmingham Medical School here, right? I just did not know that, and I thought, wow, look at that. You've got the QE, behind the QE you've got the women's, and then the thing to the right is the Harborne. That's the new private hospital that's been built on NHS soil that's sharing beds. I mean, wow, what a fantastic model that is. And then you've got the medical school literally 5 minutes up the road, which means they've got all that talent and can just walk down the road and help me be entrepreneurs.
Well, think of the skills that we're generating
100%.
just in that area. And then you've got this to allow small, medium enterprises to start up. It's just the perfect place to be.
100%. So when I first qualified, when was that now, 1991, like 1990, 1991, there were loads of jobs for life scientists, loads of companies, loads of pharma companies. And they've kind of, over the years, have just consolidated and the jobs have got harder to find. I want to be able to create loads of job opportunities. If they fancy a career in life sciences or health tech or what have you, that's what we're hoping to achieve, basically.
And it's interesting if you think about why Birmingham. Birmingham has one of the most diverse populations in the UK. We've got 99 different languages spoken just in the city. So if you were to lift the population up, you've got an example, a microcosm of the world right here in Birmingham. So when you're doing tests and trials, you've got a mix of everything. So what an opportunity.